shots, shots. Most children get them every time they go to the doctor. Some parents do what the doctor says is best and what's recommended, but other parents do their own research and opt out of vaccinations for their child. Vaccines have been around for many centuries, but recently parents have been questioning whether a vaccine saves or harms a child's life. Vaccines are very common in the United States. You probably remember getting them almost every single time you went to the doctor when you were younger, and even some today. So you start at a very young age, as little as 3 months old, unless your parents decide to say no. According to consumers researchers, vaccines are the weakened form of small amounts of the organisms that cause a certain disease. So basically, you get a small amount of the disease that you're trying to prevent injected into your body. The reason for that is so that you fight off the infection and therefore you get immune. So that if you were to come in contact with that disease or that infection, you would be immune, you wouldn't get it in your system. Vaccines can save a child's life. Vaccines are 90 to 99% effective in preventing the individual from being affected by a certain disease that the vaccine was preventing. Shot at Life, a United Nations Foundation partner organization, says, vaccines save 2.5 million children from preventable diseases every year. Vaccines have slowed down and even eliminated some viruses and diseases that used to affect and kill millions of children and even adults. An example would be smallpox. You no longer get vaccinated for smallpox because the virus has been eliminated because of vaccines. Herd immunity is the resistance of the spread of a contagious disease amongst a population through vaccination. So, herd immunity, someone gets a vaccination, therefore it protects other people who are not able to get a vaccination. Individuals like this rely on herd immunity because of their old age or poor health. An example of this would be chemotherapy or cancer. Say a vaccination comes out for COVID-19, people who have cancer or are taking chemotherapy cannot get a vaccination unless they want to harm themselves with the vaccination. But vaccinations also protect future generations. An example, a vaccinated mother protects her unborn child from birth defects that vaccinations can prevent. Vaccines affect children in a very small way. The most dangerous side effect is an allergic reaction, which you don't know if you're going to have one until you get the vaccine. An allergic reaction happens in 1 per million vaccinated children. Dr. Sanjay Gupta, chief medical correspondent for CNN, states to procon.org, "You are more likely to be struck by lightning than to have a serious allergic reaction to the vaccine that protects you." So basically, an allergic reaction is very rare. Now, some of the normal side effects would be, as you can see, pain and swelling at the injection site. You basically get a shot, so it's going to hurt a little bit. You might get a little bruise. A low-grade fever, fatigue, headache, and the reason for all of these is because you basically are fighting off an infection. You are fighting off that infection so that you become immune to the disease. According to Centers for Disease Control, also known as CDC, all vaccines carry a risk, but taking that slight risk can save millions of lives, including yours. Vaccine-preventable diseases are still around, and vaccines can destroy them. The CDC notes, many vaccine-preventable diseases are still in the United States or only a plane ride away. There were 880 measles cases reported in 24 states between January 1st, 2019 and May 17th, 2019. Every year, 118,000 die from measles, which is a vaccine-preventable disease. Some believe that there are harmful ingredients in vaccines, which there are, but not in the amount used. Aluminum can be harmful in the big picture if you use a ton of it injected into your body. but there's not that much in a vaccine. There's very little, and aluminum usually is present, but not enough to cause any harm. And breast milk contains more aluminum than you are exposed to in a vaccine. And children are exposed to more bacteria, viruses, and other harmful substances in one day of normal activity than vaccines. The Food and Drug Administration, also known as FDA, says to Procon.org, all vaccines go through at least 10 years of testing before they are licensed. And the FDA and CDC monitor to ensure safety of the ingredients and side effects. Major medical companies know no one should be worried about a vaccine because they believe that they're the safest medical products you can have. A rising number of parents are saying no to vaccines. In 8 states, 1 in 20 public school kindergartners did not have a full list of vaccinations required by the school. If children get infected with a disease, it costs your parents time and money. Parents would have to take time off of work, while if you have expensive medication or are in a hospital, medical bills are adding up. And your child could be contagious up to 30 days. That means 30 days of school missed and 30 days of work missed. One case of measles in Arkansas cost the health department $47,962. But under Patient Protection and Affordable Care Act, many vaccines are free to the public. Parents get concerned that the government is making medical decisions for children. They believe that they need the final say for health of a child, and it takes away their freedom. And it's against their own will putting that into their body. They believe that the freedom is stripped from their hands. Now, in the United States, everybody gets a freedom of religion, freedom of speech. But several religions do not believe that vaccines are helpful. The Amish communities believe that they actually weaken the immune system instead of helping it. The Universal Family Church believes that God makes health decisions, and that should be honored by authorities. Some vaccines are even made with immoral ingredients. The chicken pox, hepatitis A and B are cultivated in cells from 2 aborted fetuses. Now, the Catholic Church does not believe in abortion, and there's really no way to avoid it if you were to get these vaccines. Now, vegans and vegetarians have a conflict with vaccines as well, the flu shot especially. The flu shot can be made with animal products such as chicken eggs, insect cells, pig gelatin, and cells from monkeys. Some vaccines are even found with ingredients from human blood. Now, the vaccine topic has been widely debated, and for a long time, vaccines were considered a major advancement. But the growing number of parents refusing is causing uproar. Their fear of harm is overriding the doctor's stand for the benefits. One of my solutions is that all vaccines are required to attend to attend any school. It's the only way to keep children and adults safe from harmful diseases. If a parent decides that they want to say no, so they still have the right to say no, their child cannot attend school, public or private. So they would have to be homeschooled, or they would have to get all their vaccinations and go to school. My solution number 2 is that there's no requirements for school, but the doctor would strongly encourage the ones that are very popular and need to be done, like diseases that are very popular, like the flu. Like a flu shot, the doctor can recommend it as much as they want, but they cannot force the use. So the parents still get a choice, and they need to identify the reason for not giving that choice. So vaccines have been around for many years, but many people believe that they're not helpful, but also many believe that they are.